One of the things that we're really proud of in our foundation is the support of our community houses. We have 4 community houses, have 4 great boards, and the community houses do a wonderful job, seeing about 17,000 patients every year through those community houses. Never did we ever dream that this many people would be touched by those community houses. We're thankful for your support, $440,000 it takes to actually support those houses every year. You, our gracious donor, give those dollars. Thank you for that. We want to show you a short video, just about a little snippet of what our community houses do at this time.
Our service area here in Baxter County and our other 13 counties is about 10% of our overall population is affected by diabetes. And so the services of being able to take care of diabetes patients and their chronic disease is really a much needed and a much appreciated service that I see from our patients. Our services include classes for type 1 diabetes and type 2 diabetes. We also offer a gestational diabetes class for our moms who are expecting. Being able to provide that education on such a individual level for them is I think really important to our folks and to their disease management and how they are able to take care of themselves as well. One of my favorite things to talk about is our diabetes support groups. We also have a group that gets together for our diabetes kids, and I think that's one of the neatest things that I'm allowed to do and I'm able to do for our folks is get them together and get their families together, because when you have a child with diabetes, it doesn't just affect that child, it affects their whole family. And so we provide the parents and their siblings some support by going on some group outings and doing different things that incorporate nutrition, maybe some exercise and different types of things. And it just makes me smile because I think about when I see them all together and everybody interacting as a group and learning from one another. I think that's what a support group is all about. And then we've started a type 1 adult support group. One of the other service projects that we have taken on the last few years is a diabetes community outreach. And what that means is we take our diabetes education program on the road and we travel around to different counties and different areas to be able to provide the type of education that we have here in Mountain Home. One of my favorite patient stories involves one of my kids that we see on a regular basis. And one of the favorite things that I recently got to witness with her was she came into the office here to have a checkup with us, and another patient walks in the office, a lady who was struggling with her diabetes as well. And after the child left, the adult lady shared with me, "I'm not going to complain anymore because I see what these kids have to go through, and it makes me so very happy that I'm able to control my diabetes the way I am and not have to do some of those types of things." She said, "I'm very grateful, and I'm very grateful that I got to meet this little girl today because it gives me a whole new outlook on my diabetes management." And so I shared that with our young patient, and she was just thrilled. She said, "I can't believe that my diabetes made a difference to somebody else's diabetes." None of the services here offered at the Reppell Diabetes Learning Center would be possible without the support of our advisory board, the Baxter Regional Hospital Foundation, our volunteer services and how much they help us in all of our community support houses, and also from our financial support from all of our donors. And so we're so very thankful. I'm very grateful every day to be able to do what I do, and just always remember, if you have any needs or if there's anybody that could possibly benefit from any of our services, just send us our way or have them call us. Our number here at the Diabetes Center is 508-1765.
We are dedicated to helping people live longer, healthier lives. So through our services, we have free learning sessions that address aging concerns. Last year, we provided over 30 free learning sessions to our seniors, and over 500 of them attended our classes. One of the most important services that we offer here at the house are our support groups. They just help people maneuver through some of the most difficult times in their lives, whether it's through chronic conditions or maybe the loss of a loved one. We also have a support group for our caregivers who are taking care of their family members with Alzheimer's disease. We also offer free resource packets here at the center. On any given day, we'll have someone that will just drop in after a doctor's appointment and they've just been diagnosed with maybe Alzheimer's disease, Parkinson's, or some other chronic condition that just took them by surprise. And so they come in looking for educational material, but they also are coming in looking to be able to talk to someone about this new information that they've just received from their doctor's office. So we're glad to be here for them. One of our other classes that we offer is our AARP Safe Driver class. This gives them an opportunity for an insurance premium discount, as well as refreshing their skills for becoming safe drivers. We have exercise classes available every day, Monday through Friday. We have 25 plus participants every morning that comes through our door. They have regained flexibility, mobility, balance, reduced their fall risk. One of our newest classes that we offer is Rock Steady Boxing. This is a non-contact boxing exercise program that helps people fight back against Parkinson's disease. This past year, we had a lady that began exercising with us. When she first came to us, her caregiver had to drop her off at the door, and she came in with a cane and was very depressed. Within months, we started to see her depression lift. One day, she came in without her walker, and then before we knew it, she had started driving again, and she's so excited to be able to just drive herself to Walmart, not rely on anyone else to have to take her places. We couldn't do all of these programs that we offer through the Mruk Center, most of them free of charge, without the support of our community. We also have a wonderful advisory board, and also we have an amazing volunteer staff. If you would like to come by for more information, or you want to give me a call because maybe someone you know or you yourself has been touched with Alzheimer's disease, Parkinson's, or any other aging concern, give me a call at 508-3881, and I'll be happy to sit down with you and just see what ways that we can help you through our services that we offer here at the Mruk Family Education Center on Aging.
Our community support house focuses on providing health information to women of all ages, from mothers with newborns to teen girls, working women, and even seniors into the golden years. Women tend to typically put their own health needs aside as they focus on their families, their spouse, their children. So our goal is to help bring women's health to the forefront through programs, classes, and support groups that we offer. Each month we host Schliemann learning sessions and lunch and learns, which focus on health topics of all sorts: nutrition, osteoporosis, menopause, gardening, urological health, anything and everything that will assist women in living their best lives possible. Our Girls Night Out and Working Women in the Know programs offer heart health information. They help teach women how to balance their personal and professional lives and allow women to network and connect with each other and share their life experiences. We also offer prenatal classes that provide expectant parents all that they need to know about the birthing experience. Each year, we partner with ASU Mountain Home to present our amazing Teen Girls Go to College event. And this program focuses on teen girls who maybe have not considered their college and career options. This year, we were able to award 22 scholarships to young ladies from districts throughout the 14 county service area of BRMC. What's wonderful about these groups is that you can hear the ladies as they visit with each other each month and share how much they feel validated because they're able to identify with someone who is going through the same situation, running into somebody and talking and just identifying that you're not alone and there's somebody there with you. It is just the most amazing experience to hear those testimonies. None of our programs and services would be possible without the financial support of our donors. the time, commitment, and energy from our advisory board, and the various health providers and field experts from our community who volunteer their time to speak and teach, and local businesses even, who through their sponsorships help us achieve our mission of bringing health education to women of all ages.
We have educational information available, our binders that have an overview of the cancer, treatment options, questions to ask the doctor, nutrition, financial resources, a wealth of information that a cancer patient needs right away. They usually come into the house hearing the scariest word that they can hear, cancer, which is an unknown of the future. So we're here to offer support, hope, encouragement, and by the time that they walk out the door, they have a smile on their face and a heart full of gratitude for what we do. We have over 3,000 survivors in our community that we reach out to serve. We have wigs, hats, scarves. We give out about 400 of those a year. The ladies really have a great time, puts a smile on their face after they begin losing their hair. We have bras and prosthesis for women who have undergone a mastectomy. We have approximately 800 breast cancer survivors in our community, and everything at the house is free. We have care packages that we recently started providing for cancer patients. We have support groups for all different types of cancers for men and women and caregivers. We had a young lady with a 3-year-old daughter that came into the house, and you could just tell how scared she was. The unknown. She had no idea what to expect. She was so thankful. We gave her education, we gave her materials. The volunteer and I hugged her, prayed for her, offered her information for her spouse, and she left here so thankful and felt like we were her friends. And then a month later, we got a thank you note from her saying just what a difference we make here and made in her life. None of this is possible without our wonderful advisory board members, volunteers, and donors. If you or a loved one has been diagnosed with cancer, please don't hesitate to give us a call at 508-CARE-2273. We're here from first diagnosis and beyond, and you're a survivor from the moment you hear that diagnosis.
As you can see, there's a lot going on that the foundation supports. Again, I'm amazed at the generosity. Without you people, without the others that are not here but would be, this wouldn't be possible. And I want you to look around, and you'll see some of the most generous people in this area that have a heart for care. So I think you just give everybody a round of applause. And I think it's my turn to introduce Sally Gilbert, Chair of the Hospital Board.
Thank you. Good evening. And you know, I know this to be true, but it's verified today that Barney is living right. How about the sunshine today? You know, we're so fortunate. Good evening, and I want to thank you all so much, and it's a privilege for me to share in this night honoring those individuals whose generosity allows us to live out our mission, which is providing excellent care for every patient every time. Your thoughtful gifts have both an immediate and a lasting impact on the community in which you live and on our pursuit of excellence. Thanks to you, in 2016, we were able to assist 17,000 people walk through those houses that you've just learned more about. that doesn't count those families that many go back and share the information with, so I'm very proud of that. We maintained our level 3 trauma designation, and you know that is a great thing for our community if you're ever in need of that. We became the first licensee of the community paramedic program in Arkansas, and I would wager to say there's probably some people in the audience who have benefited from that great service. First in Arkansas. That was a wonderful day and wonderful things for our community. We renovated the cardiac rehab center, and I'm sure some of you have benefited from the services provided there. And we're the first in Arkansas to provide that rock steady, and there are people here, yay, who are my friends, and I'm so thrilled that they're benefiting from that program that helps Parkinson's patients recover and live a very healthy life. Those things are astounding, and can you believe, first in Arkansas for 2 programs. I'm quite proud to be a part of this organization, what the leaders do, and what you all have helped us accomplish. Many of you know that I'm a farm girl from Southwest Missouri, and some of you may not, but I am, and I'm proud of that. And I happen to know a farmer who's very near and dear to me, and he's a farmer that grows corn in Southwest Missouri. And if you know much about Missouri, it's predominantly a beef, cattle, and fescue area. This farmer was one of the first to begin growing corn in his fields in Missouri. And he was quite successful at that, and each year produced more and more corn, beautiful fields, and it produced more bushels of corn per acre than not only had ever been done in Missouri, but in many communities such as Kansas and Iowa. It was so exciting that a reporter came down to interview this man and said, you know, what is your secret? What makes you grow the best corn and have such a great production and outcome? He said simply this: I share my seed with my neighbors. This kind of puzzled the big city reporter, and he said, well, why on earth would you ever want to share your seed with people that are in competition with you? He said, well, don't you know that when you grow sweet corn, the wind picks up pollen from the ripening corn and swirls it from field to field. If my neighbors grow inferior corn, cross-pollination will steadily degrade the quality of my corn. If I'm to grow good corn, I must help my neighbors grow good corn. I had the privilege of driving around with him one afternoon, looking at his fields, which he's very proud of, and he looked over at me and said, Sally, God blesses you with opportunity and good fortune and blessings, and He does that to see what you'll do with it and how you will share that good fortune with others. And if you do that, you've done your best in life and lived out your purpose. I applaud every one of you here this evening for doing just the same with your good fortune and sharing with others in order that you make our community not only a better place, a healthier place, a happier place, and a greater place for our children to grow up. And I also thank you for the example you set for future philanthropers, and I'm hopeful that I have one with me this evening. From the bottom of my heart and from the entire hospital board, I say thank you so much for continuing to allow us to be the first in Arkansas in many cases, and in my opinion, the best quality health care in Arkansas. Thank you.
Good evening. My name is Ron Peterson, and I am President and CEO of Baxter Regional Medical Center. Thank you for allowing me to speak to you this evening via video. This is the first time in 10 years that I've missed a donor banquet, and I believe it is my loss, not yours. Even though I am taping this early, I already miss that wonderful feeling you get when standing in a room with over 400 people who have a vision and a belief in the same goal and same purpose as you do: to ensure access to high-quality medical care by maintaining a comprehensive, independent, and community-driven healthcare system. Thank you for your support. Tonight is an evening of gratitude. Tonight is an evening we affirm the goodness of you, our donor. Tonight is the night that we say thank you and acknowledge that the source of your kindness and generosity is above and beyond what Baxter Regional Medical Center could do on its own. Without you, we could not remain comprehensive, independent, and community-driven. So again, I thank you. Gratitude provides the moral memory of mankind. It encourages one to not only appreciate gifts, but to also repay them. Baxter Regional Medical Center appreciates your generosity and support and wants to show its appreciation by ensuring that you have access to high-quality health care. For example, a few months ago, a patient who lives over 40 miles from the hospital contacted our dispatch and told them he was having a heart attack. We dispatched an ambulance to his house to get him to a helicopter, to get him to the hospital, to get him on the cath lab table, and to insert the catheter in his vessel, all within less than 60 minutes of the initial phone call. That is access to high-quality health care. BRMC recently received notification from a national advisory service called Health Grades that reads as follows: congratulations again. Health Grades is pleased to announce that your hospital is a recipient of the 2017 Patient Safety Excellence Award. Your hard work and dedication to patient safety has placed you among the top 10% of all hospitals in the nation. This award acknowledges that over the last year, your hospital found ways to measurably improve patient safety, was a leader in prevention of safety incidences, and demonstrated better than expected clinical outcomes. That is access to high-quality care. In addition, in 2017, the National Rural Health Association's Rural Health Policy Institute named Baxter Regional Medical Center as a top 100 rural and community hospital. The score was based on hospitals that were top performers in managing risk, achieving higher quality, securing better outcomes, increasing patient satisfaction, and operating at a lower cost than their peers. The company conducting the research study said, "Our research shows that these practice leaders share key attributes that dovetail with the CMS-driven shift to value, showing that rural hospitals can offer the best quality at the lowest cost." That is access to high-quality care. Like all hospitals, we are not perfect, and we do not have all the answers. Although our quality numbers look very good when compared to national standards, our physicians, nurses, support staff, and volunteers have adopted the phrase, "one is not none," when it comes to providing quality care and patient safety. We never want even one patient to receive anything less than the highest quality of care, especially since we live in a small, rural community and are many times treating respected friends and family. Thank you for your kindness. Thank you for your support. And thank you for your generosity. We are truly grateful. Your kind and giving hearts work hand in hand with our commitment to quality. Again, thank you and have a great evening.